do have the panel now. So I know these are the hot seats. I'm going to invite Liris, Mark, Michelle, Asia, Fiona, Dana to come on up. And if there's questions from the audience, now's the time to ask questions of these amazing researchers and research professionals. There's got to be time. Oh, who's on? Fiona. Okay. And Fiona, if you can turn your camera on. There we are. Hey. I'm going to pin you. Thank you. Wonderful. So are there questions of the research that these groups have presented? Everyone's jumping up. It was overwhelming amount of information. Thank you. Pull the mic down and there we go.
Call attention to the fact that I was pulling the mic down, but I appreciate it. I'm loving the talk height all day today.
Yes.
Really.
I'm even wearing heels. So introduce yourself and then ask your question.
My name is Anna Bilowitz. I work with Y-Spore with some of the lovely folks on stage. And as part of my work, I've been fortunate to look at data, which we've all talked a lot about today. And one of the things that I really appreciated, thank you for all of your presentations, drawing attention to that intersectionality. But one of the things that I noticed is that when we look at small communities, disaggregating the data to call attention to that intersectionality often turns unidentifiable data into identifiable data. And I was curious about how you balance that and navigate how disaggregate data respects people's confidentiality. Thank you.
Go ahead. I see you're keen to answer.
That's such a great question. So this is what our organization, the Yukon Status Women Council, has been like contemplating for many decades. Charlotte Renchuk, who is sitting at the front, sorry to draw attention to you, Charlotte, was the coordinator of the status for 2 decades. Stand on her shoulders. And what we need to get beyond that question, right? Like, we're not advocating for law reform with respect to privacy legislation like ATIP or like HIPAA or like the Federal Privacy Act. Like you mentioned, these kinds of considerations for privacy are essential when it comes to small communities where we cannot, as Paul Kiszczak, I think, has popularized as a phrase, big N is smaller than little n for the statisticians in the room, right? The idea that the population sizes are too small to derive any kind of meaningful samples from if you're using quantitative methodologies. Therefore, that's why we're talking about qualitative methodologies where you can do things like thematic analysis, but that only is effective so long as those who are making decisions, people in positions of policy development and power making, value those kinds of methodologies, i.e. there's trust there. That's number one. Number two, if we cannot bridge that gap that exists between the lack of access to disaggregated data, meaning that we are invisibilizing people and neglecting those folks who are in the margins of the margins, then we need a paradigm shift. And that fundamentally boils down to, it has to come down to how well resourced our communities. If we're not able to measure and therefore monitor based on these data limitations and gaps, then we need a different paradigm for rural, remote, and northern spaces. And that is about how well resourced those communities are. Is there a women's shelter? Is there not? Are there access to frontline violence response services? What's the level of housing availability? Like, this is the part we're trying to drive home, is that we see policy decisions made all the time, assuming that there's access to these kinds of data that actually don't exist. I'm going to give a really concrete example. The coroner's reports that have been coming out cannot be disaggregated according to a number of Indigenous women who are dying from the opioid crisis. We know how many women are dying, we know how many Indigenous people are dying, but based on privacy legislation in the Coroner's Act and elsewhere, we cannot aggregate those data, right? Because of the potential for identification and like loss of anonymity. But I mean, I can go on for hours about this. I'm going to stop. So resourcing communities, building from like every level of legislation, an understanding of what those fundamental data gaps and limitations are. Because if we're not going to like reform laws about that and rewrite them, then we need a different approach.
And I think that's an incredibly important part. I'm not going to ask anybody else to ask or answer that question. We have a question online, or somebody online. Khulud, Baig, do you want to ask your question?
I actually wanted to contribute to what Asia was just saying about creating a different paradigm, and some of the work that we've been doing, just some of the work that I've been doing or I've been engaged in. And I think it's just so important to give communities ownership of the data that belongs to them and give them essentially like the tools and agency to use that data in the way that's most useful for them. I think relationships of trust and relationships of um, working together in a way that at the end of the day communities feel in full control of is so important. And oftentimes I think when we start working with government agencies or government itself, that relationship of trust isn't there, and then you see a survey that's launched and many people not responding to it or choosing to not respond to it, particularly in smaller communities, rural and remote communities. So it's so important to, before launching a survey or before doing any sort of data collection work, to actually create a protocol that's going to give control and agency in the hands of the community where data is being collected. And I just feel like many times when work like this is done, the first thing that comes, or the first thing that the community hears about it is the survey itself, or is, the end product itself, and no preceding relationship building and protocol setting of how data is going to be collected and used, and what kind of controls and agency any given community is going to have over that data. So I think part of the work in decolonizing our approaches is rethinking entirely how we do data collection and how we work with data.
Thank you. I think as I'm listening to all the presentation, there are themes that pop out. It's about relationship. It's about building, empowering community, and really allowing, like we have a by names list for homelessness here. How does that translate into policy that we're talking about with small populations in our communities? And the whole principle of OCAP and how that applies, and Indigenous data sovereignty. I think there's a whole bunch of discussions that can come out of this. I just got there was a comment online that I just want to read out, and it was from Amy McKinnon. And Amy is saying, really, really great and meaningful work. I'm digesting some big themes like data collection, advanced planning, mental health supports, and intersectionality. Capturing people in the margins of the margins is so important. Thank you. So very big kudos to you guys. Are there other questions or comments? Yeah, go ahead.
Hi, my name is Stephanie Hawkins. I'm the Director of Evaluation at the Government of Yukon. Just a question about some of the themes that have really come out in terms of engaging the communities are these pieces around capacity and trust, and particularly in the context of a crisis, but also this idea of connecting with the frontline workers sort of in those moments to get their perspective. So I was wondering, in your surveys or in the data collection where you heard from frontline workers, like, we want to be heard, did you also get feedback about what sort of systems of a capacity and trust and the sort of permissions would need to be in place for them to want to open the survey, to feel comfortable answering it, to feel that it was legitimate, and that their considerations would be taken into consideration in a very timely manner, in a manner that was sort of fast enough to inform the government decision-making process? Thanks.
I guess I can answer from our study, from the healthcare workers. I feel that the healthcare workers were in a a position where they really felt, as Mark had said, that their voices weren't at the table, and they really needed to be at the table all the time. And I think I would also add to that I think the people with lived experience, the patients, the receivers of the healthcare system also need to be at the table, but that's another story. But I also believe, as you were talking about what does that mean, I think people also expressed to us that there was an opportunity, because I guess at this point in time we're looking at some significant changes in the Yukon healthcare system. So we heard people with a bit of message of hope that maybe if we move towards, put this idea of putting people first, which is the document, is the foundation of looking towards, like a health authority and that sort of thing. They saw that there may be opportunities, and this is an opportunity really to make a change and to have their voices heard.
I guess I could add as well that I think from the perspective of the educators we spoke with, it really had to do with these antecedent conditions. So before any sort of crisis or before any sort of workplace conundrum presents itself, there needs to be explicit attention given to creating spaces within these systems and structures that already exist for, like, from our perspective as educators, but I'm hearing it about healthcare workers and I'm hearing it about others within the community, that there needs to be these lines of communication and these intentional places of dialogue to inform, like, myself as an academic researcher, I feel ill-equipped to answer that question. I have to, again, return to the voices of those who we spoke to, who are saying they want a seat, like, they want a seat at the table. They want to destroy the table. One interviewee talked about tables are great, but we shouldn't be sitting around a table. We should destroy it and create a fire and then sit around the fire, which I thought was really interesting and powerful. So, yeah.
I'll just pop in and say, for us, with any kind of engagement that we do through a participatory action research model, that means co-creation of those questions from the get-go. And that's an iterative. We hear that word a lot in this space in particular. Researchers love that word. But I'm just trying to find Stephanie, it takes a lot of time, which B, translates into core funding for those grassroots organizations who have the built trust and connection with community, who are non-institutionalized and non-governmental, and a fundamental recognition of the value that those kinds of processes and relationships have in shaping a well-resourced Yukon for all Yukoners. And I think what we have all seen thematically throughout the dialogue this morning is that all this did is amplified pre-existing inequities. That's what this did. These inequities, a lot of them are very much not new. All this did is it turned the volume up. So if we're going to be responsive, that means paying very close attention to how we can build more equitable societies as a way to buffer future crises and disasters. And that means investing in communities that have that established relationship. Thanks for the question, Stephanie.
I wanted to check in with Fiona online to see if she had anything to add. You don't have to.
I don't really have anything to add. I mean, on that specific question, I think the response, I would agree with the responses. In terms of surveys, I would agree with Asia. It makes a big difference who makes the sort of initial announcement about the survey and the trust that people would place in the organization that has announced this survey. Whether or not other groups have been involved in the construction of the survey questions. And I would also agree with the points that have been made about how the survey is delivered and who is going to access that survey. So we can see that some surveys will have very high response rates and have quite large sample sizes, but they will miss the more sort of vulnerable people in a community because they can't access the survey in the way in which the organizers are delivering the survey. So I would agree with those 2 points that have already been made.
Thanks very much. You'll notice I'm not Mathia. I'm taking over for a minute. I just wanted to give these teams the same opportunity the last panel had to give us your one key takeaway. If you want the audience to leave with something, what would it be? And I'll just start at this end.
Thanks. I think I'm going to go with my own reflection of the most positive takeaway, I think, from our study, because a lot of it wasn't as positive to look at our healthcare system and the cracks in the system. And for me, it was the people that had still had the drive to provide the care for Yukoners and really cared about the patients, residents, and clients across the spectrum. And that level of moral distress they still had. I always think in healthcare, because I came in as a clinician first, apathy is the greatest fear I have when people get to that point. But we have a lot of really well-intended and very caring healthcare providers here. So I think with that, then there's opportunity for the future for us to move forward and maybe recreate and make a better system.
Is this on? Yeah. Yeah, Liris, I think that's a really good one. Just to kind of add to that, one of the big takeaways for me, I'd say, is kind of that idea of really changing the system. And whether it comes down to like staffing is obviously a big one that a lot of people hear and a lot of people talk about. But really, and this is coming from some of the recommendations that participants made, but having a strategic plan for retention and recruitment. So we know that there's been a recent retention bonus from the Yukon government for all the YG employed nurses, but that only covers a fraction of the nurses that are working. So that's another thing I think to consider. And then, yeah, just making sure that we're supporting and we're finding ways to support the healthcare workforce, and we're directly asking them what they feel they need to be supported, because ultimately, without supporting the healthcare workers and the workforce, there really is no system to deliver care. So it's really important that we try to bolster their capacity to provide that care.
I guess I want to leave you with, like, educators are incredible people who were creative and innovative and adaptive and really centered students. I don't think I hammered home that point because I was really focused on getting everything out, but the solutions that were derived from people and from schools and from communities and from others who were involved in these processes, it was pretty remarkable, and I think it happened across a lot of different scales. So that did include the department and the consultations with different sectors and spaces, and some of these happenings, it was unprecedented times, right? Like people made it work by focusing on student success, and I think that's really something to be said. So.
Two things. You cannot manage or mitigate what you're not monitoring. We've emphasized data gaps. And I'm actually going to quote somebody who I never thought I would quote in my entire life. But it's John Maynard Keynes, the economist. And he said, "There's nothing a government hates more than to be well informed, for it makes the process of arriving at decisions much more complicated and difficult." That's not to rag on YG or any government. And I'll leave it there. Thank you.
I think I'll just build off of what Asia was saying, but continuing on with other work that we do or that we're all doing, leaning into creative ways of recruiting and accessing these people who live in the margins of the margins so that we are reflecting their lived experience in the policies. For example, for thinking about social assistance, one of the things that is not considered essential is communication devices. But during the pandemic, that was a very key piece of technology to have, or access to have, to prevent things or, help escape from gender-based violence, connect with your community, connect with your family. We just need to keep leaning into these alternative methodologies, so that we're building better policies.
Do you have anything to add? Are you unmuting, Fiona?
Well, sorry, I didn't realize that you were asking me for. Sorry, I was just enjoying everybody else's comments. I think data matters for sure. I think policy design matters, so how policies interact with each other. And I agree with the other comment that if the pandemic has shown us that inequalities have increased, but there are also new fault lines which have emerged, and that we have to learn and address those. And one of the things that I actually really enjoyed about this panel was that the work on the education and the work on the healthcare workers provide really detailed and rich information about the general argument that we've made in our report, which is about the paid care work penalty experienced by women. And so I really enjoyed the analysis of the other papers and the policy recommendations coming out of all of these papers really are sort of very complementary.
And on the panel for your great presentations and the discussion. We're only a few minutes late into lunch, so that's pretty remarkable considering how the limited time we gave everyone to present. Can we get a round of applause before they all leave?